Dental care for epileptic patients. When visiting the dentist as an epileptic patient, it's important to provide the following information: the nature, frequency, and pattern of your seizure, your seizure triggers, any medication you currently take, your epilepsy management plan if you have one. Fluoroquinolone and penicillin can trigger seizure in people with epilepsy. These antibiotics have been associated with lowering the seizure threshold, making seizure more likely to happen. Erythromycin can interact with anti-epileptic drugs, potentially affecting the level of them in blood. If a patient has a seizure during dental procedure, here are the steps you should follow. Stay calm, ensure safety, caution the head, turn to the side, time the seizure, do not restrain, monitor breathing, and after the seizure, once the seizure stops, help the patient to a safe place to recover and monitor their vital signs. If it is their first seizure, or if they have multiple seizures without regaining consciousness, or if they are injured, or if the seizure lasts more than 5 minutes, seek medical help immediately. Some anti-epileptic drugs like valproic acid and phenytoin can cause bone marrow suppression, which may impair wound healing and increase the risk of post-operative bleeding and infection. Gingival overgrowth, which can complicate dental procedures. Platelet count can decrease, which increase the risk of bleeding during or after dental procedures. Besides mentioned side effects for valproic acid and phenytoin, other medicine like carbamazepine can cause xerostomia, dry mouth, which increase the risk of dental caries and oral infection. Regular dental checkups and good oral hygiene practices can help mitigate these effects. For epileptic patients, it's important to choose anesthetic that minimize the risk of triggering seizure, like propofol or thiopentol. Lidocaine can potentially lower the seizure threshold in some patients. It is important to do aspiration before injection, which help prevent injection the anesthetic directly into the bloodstream. For epileptic people, it's better to go to dentist office with a friend who know what to do if you had a seizure, use your medication on time, and have a good night's sleep the night before, and avoid seizure triggers. As pain, infection, and stress are triggers for seizure, it would be better if dentists lower its dental chair as it's possible to prevent fall down if seizure happen. Also, dentists should do the dental procedure as fast as possible to avoid any complication.